One of the tools in successfully battling cancer is early detection. That's when doctors are able to find the cancer before it has a chance to grow and spread to other parts of the body. There are some tests that can be used to look for cancer. During Women's History Month, we're highlighting health. Breast cancer is the most common cancer in American women. Here to help us talk about this is Dr. Stella Sappho. She's an HIV primary care physician and founder Just Equity for Health. Also joining us is Gerald Commissiong. He's the president of Provista Diagnostics and has more than 10 years of therapeutic and diagnostic development experience. Thanks to both of you for joining us today. Dr. Stella, I'm going to start with you. When should women start getting yearly breast cancer screenings?
So really to avoid what we've seen in the past, which is a lot of possibly false positives if you're getting your screenings too young, the recommendation now is 50 and up, unless you have a family member who's had breast cancer. Then they recommend 10 years before that family member developed breast cancer. And so for some women, it may be 40 and up, depending on your family history. But for most women, it will be 50 and up.
Hey, that's where we want to start with women, 50 and up. Now, Gerald, your company, Provista Diagnostics, has a blood test to help detect breast cancer. Can you explain to us how that works?
Sure. So the blood test takes, we take the blood out. We have a proprietary software where we are looking for specific markers of serum protein markers and tumor-associated antibodies in the blood. And then there's an algorithm to identify the tissue of origin. And the most optimized algorithm that we have is related to breast cancer. So the concept behind the test that we can identify these cancer markers in the blood and associate them with breast cancer really started and was perfected around the issue of dense breasts. You see there the images of imaging with dense breasts. Oftentimes, you're in a situation where the image, you can't get an accurate depiction from the image because the density of the breast is too much. And so you get inconclusive results. And then those people end up going on for more invasive type of diagnostics. Our test is designed to overcome that. Also, we're going after women who are looking at potential recurrence, so previous breast cancer patients, as well as women who are not yet eligible for mammogram due to age, because they don't necessarily have the history or the family history of cancer risk.
Dr. Stella, what are your thoughts on having this type of test?
So I think when it comes to cancer, and especially early cancer diagnostics, there's a lot of work that's being done to find multiple modalities. And so the standard way of finding breast cancer is, as we've just mentioned, through imaging. But exactly as been said, if we can find another way of detecting it even earlier, before it starts to spread or before it starts to really take hold, that would be the ideal. And so this kind of technology, which we've used for other cancers like colorectal cancers, certain lymphomas, is really welcome in the field of breast cancer research if it's going to allow us to be able to have women use these non-invasive procedures to find the cancers before they take hold.
So, Gerald, when would you recommend a woman have this blood test to detect breast cancer?
Well, we're positioning it, so that women can start as early as possible. The big challenge is that they've been moving back, almost annually or, every few years, the age at which you should be getting mammograms. The problem when that happens, of course, is that you end up finding later stage breast cancer in young women, because some percentage of young women, of course, are going to end up developing it. So if you have a blood test that's non-invasive that you could do at your annual screen or some other, time when you're giving blood, and just to, make sure, that could add a lot of resolution and potentially catch cancers earlier. So, our view of this blood test gets on the market, we would recommend, women, maybe every 2 to 3 years, starting at the age of 25, just monitor this. And obviously, if there's anything that, looks like it could be problematic, then you can advance them to some of these more in-depth analysis technologies, including imaging. And that would, I think, be very important. And the other thing that's important to recognize is that this a problem related to imaging in the U.S. is a U.S. problem, but outside the U.S., many women don't have access to imaging, or there are societal problems where they don't condone women exposing themselves to their physicians. And so they end up with much later stage breast cancer. So really, a blood test or some other type of non-invasive way to detect cancer has profound effects, not just here in the U.S., where we have significant medical infrastructure, but elsewhere where that may not be the case.
So, Dr. Stella, would a woman still have to have a biopsy after the blood test?
Yeah, so the way that a lot of these diagnostic procedures work is that if you have one that says that you may be positive for something, we like to confirm and confirm and confirm. And so one of the concerns that we have whenever we have a new test come to market, when we think about healthcare costs, is that we might get some false positives and have to go down a path of doing biopsies and other things to confirm that you really do have a cancer. And so we really welcome technology that allows us to think about finding those who are early risk for this because every life saved is a life saved. But one of the things that will happen is even if this blood test were to be positive, you'd have to have imaging and then you'd have to have biopsies to confirm that there really is cancer there. And so these are some of the pros and cons that'll be weighed as tests like this come to the market. And really the goal is how do we keep women and how do we keep individuals, as safe as possible and prevent these cancers from progressing before they really do present more advanced or even end stage.
And Gerald, what kind of cost are we looking at? How much does the blood test cost, and is it covered by any type of insurance?
Right. So this test is coming back into the market. It was in the market from about 2016 to 2018, and it was pulled from the market exactly because what you described. We have 3 prospective peer-reviewed studies with over 1,000 patients showing 93% sensitivity and a 98.4% negative predictive value. So if 93% of the time, if we tell you have cancer, turned out to be the case. 98.4% of the time, if we told you didn't have cancer, it turned out to be the case. And then obviously there are other, as Doctor mentioned, there are other types of tests that are used in parallel with that to have a whole focus. The test was priced, I think it's $599 at that point in time, but they didn't have the reimbursement. So we came along, we acquired the test, and we're in the process of doing the studies to determine what the reimbursement costs would be from insurance. And that'll be about another year, and then we'll be able to start rolling it out. So, as we look at it, this is just one tool, an important tool, but one tool as part of a diagnostic paradigm. And we believe that we're opening up the potential for screening either more often or in populations that don't currently have access to screening. And so we see this very much as additive to what's going on as opposed to replacing.
So, Dr. Stella, you mentioned this test can be used to find other cancers. Will that process be similar to how it finds breast cancer?
So, not this particular test. I think Gerald can really speak to the kind of proprietary nature and how this targets specifically for breast cancer markers, but more of this technology and the idea behind this technology, which is using certain markers that are given off by cancer cells to be able to find cancer in the body early. And one example of this is a cancer that tends to kill more often than not, pancreatic cancer, the cancer that took Steve Jobs' life. By the time you know that pancreatic cancer is there, or you know to look for it, oftentimes it's too late. And so when it comes to diagnostics for multiple types of cancers, the real goal is what tests can I use? What modality can I use to find these cancers when they first start to grow? Because the moment you're able to find them early is when you're able to intervene upon them and use treatments to be able to reverse the course of them spreading to the whole body and metastasizing and causing death. And so the idea behind this technology is one that applies, I think, across all cancers and that we're going to see be utilized more and more.
Very, very informative. Thanks to both of you for joining us today with this important development. Appreciate your time. Take care. And stay with us, everyone. We'll be back in just a moment. This is BNC.